Interventional oncology is a subspecialty within the field of interventional radiology, which is a subspecialty within the field of diagnostic radiology. It's a field that uses image-guided, minimally invasive interventions or procedures to help diagnose, manage, treat, and hopefully cure patients with cancer. The treatments in interventional oncology differ from traditional forms of therapy because they're highly targeted, they're highly focused, they're minimally invasive, and they direct therapy right to where the cancer exists, where it's present at that time. Because it's minimally invasive, the recovery is very rapid. Typically, we cover our incisions with Band-Aids. In fact, they're probably more appropriately called punctures, not really incisions. The benefits to interventional treatments are rapid recovery, again, targeting the therapy right to where the patient needs it, so that you don't have toxicity associated with more of a kind of a shotgun approach to treatment. We don't treat really the whole body. We get involved when cancers are in one or two specific areas of the body, and then again we target those areas, so systemic toxicities are much less. And then again, they've been shown and proven to be of benefit in both helping people feel better and lengthening their life. The most common forms of cancer that we get involved with and treat are gastrointestinal or GI tract cancers. Usually that's colon cancer, which is very common. There are other forms of cancer called neuroendocrine cancers or carcinoid cancers, carcinoid tumors. And it's typically when they spread to the liver that we get involved in treating those liver metastases. Another very common cancer that we get involved with is primary lung cancer. So lung cancer typically associated with people who smoke. And in those folks that cannot undergo a surgical resection of their lung cancer, we can go in and ablate or kind of burn that tumor and allow them to not have to undergo surgery. Those are the two probably most common cancers we get involved with. So our therapies fall into two main categories. One is a vascular-based therapy, where we're putting treatments into the blood vessels that go to that part of the body that has the tumor. And the other category are called ablations, where you directly puncture the tumor and kill it directly. Embolizations are kind of two categories within embolization. One is applying chemotherapy through that artery and killing the tumor with chemotherapy. And the other main form that we use is called radioembolization, where we put tiny radioactive particles, a few million little radioactive particles, into the bloodstream that then lodge in the tumor and kill it that way. Unlike embolization, where we're treating through the blood vessels and we're distributing chemotherapy or radiation into the tumor through the blood vessels by doing a catheterization, ablation is a technique where we use imaging like CT or ultrasound and use that imaging to direct a treatment probe directly into the tumor, much like we're doing a biopsy. But instead of taking out tissue, we are using a special type of needle or antenna that can either burn or freeze the tumor. And it acts very much like a rifle, kind of. If you can find that tumor and see it and get a needle to it, we can go in and burn that tumor and hopefully replace the need for surgical resection. Typically, our best candidates for treatment using our types of minimally invasive techniques are those people that have either very minimal disease, very early stage disease, like in primary lung cancer when it's very early stage 1, or for those folks that are kind of at the opposite end of the spectrum and have metastases, so spread of cancer, again, usually from something like colon to the liver, where we are going in and treating that spread of cancer before it goes on and spreads elsewhere, or before it causes liver failure and the patient passes away from liver failure. So kind of early on and kind of late.
For more information about this physician or to schedule an appointment, please call our referral line or visit notbiggerjustbetterhealth.com.